If you are over 60 and still masturbating the same way you did decades ago, I need you to hear this clearly. You may be quietly damaging your body every single time you do it. Not because masturbation is wrong, but because after 60, your body no longer tolerates the same habits. I've seen men lose sensitivity, develop prostate irritation, and struggle with erections not from disease, but from one simple mistake they repeated for years without understanding the harm. This is why I'm being so direct with you today. Never do this while masturbating after 60. My name is Dr. William Lee. I'm a physician, scientist, and the author of internationally recognized work on how the body heals itself through the right inputs at the right time. For more than 3 decades, I have studied human physiology at a deep biological level, how blood vessels function, how the body's repair systems operate, and how daily habits either support or erode health over time. I've worked with thousands of men in their 60s, 70s, and beyond. Strong, thoughtful men who assumed their bodies would age the same way if they simply continued what once worked. The science does not support that assumption, and experience makes that undeniably clear. Here is the paradox that confuses so many older men. Masturbation can support circulation, prostate health, and nerve function, or it can quietly undermine all three. The difference is not how often you do it. It is how you do it. Small technical mistakes repeated over time alter how the nervous system, blood vessels, and pelvic muscles respond. And most men have never been taught this. In this video, I'm going to explain 7 masturbation mistakes men over 60 commonly make that silently harm the prostate, reduce sensitivity, and weaken sexual function. And I'll show you exactly how to correct each one safely and naturally. This is not about fear. It is about understanding your biology and protecting your body with the same rigor you would apply to anything else that matters. Stay with me, because one of these mistakes sounds completely harmless, almost logical, yet it causes more long-term biological damage than aging itself. Before we continue, if you haven't subscribed yet, take a moment to do so and turn on notifications. I share clear, science-based guidance created specifically for men over 60. If this topic speaks to you, type 1 in the comments. If it doesn't, type 0 and tell me what you need. Now let's begin. Mistake number 1. Using pornography as your primary stimulation after 60. This is one of the most important conversations I have with older men, and it requires honesty. Many men come to me and quietly say, "I just don't feel the same anymore. Nothing excites me the way it used to." They assume their desire is fading because of age. But in many cases, age is not the real cause. What is actually happening is neurological overload at the biological level. After 60, your brain changes in measurable ways. The dopamine system, responsible for pleasure, motivation, and arousal, becomes more sensitive to overstimulation and slower to recover. This is normal biology, not weakness or failure. The problem is that modern pornography is engineered to deliver constant novelty at a pace your aging nervous system can no longer tolerate without cost. Every new image, every sudden change, every exaggerated stimulus forces your brain to release dopamine faster than it can replenish it. Over time, the brain adapts by reducing its own sensitivity. It literally turns the volume down on pleasure. This is why real touch begins to feel muted. Why intimacy feels less engaging. Why you may need more extreme content just to feel a response, and eventually even that stops working as it once did. What concerns me most as a physician is not just the loss of arousal, it is the biological disconnect that quietly follows. Men begin to feel detached from their own bodies, from their partners, and from the physical world of sensation. They don't feel broken enough to seek help, but they don't feel fully alive either. I want you to understand something important from a scientific standpoint. This is not a moral issue. It is a nervous system issue. Constant visual stimulation prevents the brain from rediscovering a slower, deeper, more physical form of arousal, the kind that actually supports circulation, nerve health, and long-term satisfaction. When men reduce or step away from pornography, especially during a short intentional reset period, the biological response is often remarkable. Sensation gradually returns. Arousal becomes more responsive to touch. Confidence improves. Pleasure feels earned rather than chased. I have observed men in their 70s rediscover sensations they believed were permanently gone. Not because they added something new, but because they removed what was overwhelming their system. Your body after 60 does not need more stimulation. It needs better stimulation. And once you understand that, it opens the door to the next mistake, one that almost every man has made for convenience, never realizing that where he masturbates may be quietly restricting circulation and prostate health without any immediate warning. Mistake number 2. Masturbating while sitting on the toilet. This is a habit men mention almost casually, often with a brief laugh, as though it is too small to matter. It is just convenient, they tell me. Private, quick, and I understand that reasoning completely. Bathrooms become one of the few places older men feel they won't be interrupted. But what feels practical in the moment can work against your body in ways that accumulate over time. When you sit on a toilet, especially leaning forward, your pelvis is placed in a position it was never designed to hold during sexual stimulation. The hard surface beneath you presses directly into the muscles, nerves, and blood vessels that supply the prostate and genitals. In younger men, the body can often compensate. After 60, it has far less biological margin for error. From a vascular standpoint, restricted blood flow repeated over months and years leads to chronic pelvic tension. Nerves become less responsive. Circulation does not fully rebound, especially when stimulation is paired with compression rather than relaxation. I have had patients come to me with complaints that seem unrelated at first. A weaker urinary stream, a dull ache in the groin that comes and goes, erections that feel less complete even though desire is still present. When we trace the pattern carefully, habits like this often emerge as a contributing factor. There is also a neurological component most men do not anticipate. When masturbation is rushed in a physically uncomfortable position, the nervous system remains in a guarded state. The body never fully relaxes into the experience. Over time, this conditions the brain to associate arousal with tension rather than release. That subtle shift contributes to fatigue after climax rather than restoration, a complaint I hear increasingly from men in their 60s. The correction is not complicated, but it requires awareness. Your pelvic region needs space and biological support, especially during arousal. Positions that allow the body to open rather than fold forward encourage better circulation and nerve signaling. Reclining, lying down, or standing upright allows blood to move freely and muscles to soften rather than tighten. These adjustments protect the structures most critical to urinary and sexual health. Your body gives fewer warning signals as you age. By the time discomfort appears, changes have often been occurring for years. That is why habits like this deserve attention now, not later. Mistake number 3, rushing through the experience. This mistake does not look dangerous on the surface. In fact, many men frame it as being practical. Life is demanding. Energy is not what it once was. So they rush. A few minutes, minimal attention, no real engagement with what the body is doing. What most men do not realize is that this habit slowly retrains the nervous system in a way that works directly against sexual health after 60. When you rush, your body does not register the moment as restorative. It registers it as something to get through quickly. Heart rate increases, muscles tighten, blood vessels constrict slightly rather than opening. This is a mild but real stress response. The hormones released during hurried stimulation are biologically very different from those released during relaxed, mindful arousal. Instead of oxytocin and calm, the body leans toward adrenaline and cortisol. Over time, this imbalance matters. I have had many older men describe the same experience. They still reach climax, but afterward they feel drained, flat, or even irritable. There is no restoration, no emotional relief. They assume this is simply what aging feels like. But again, aging is being blamed for something that is fundamentally about process. The nervous system after 60 needs more time, not less, to shift into the state where healing and pleasure occur together. Rushing also dulls sensation at the neurological level. When stimulation is fast and goal-oriented, the brain focuses only on completion. Subtle sensations never register. Over years, this narrows the range of pleasure. Men become less connected to touch, less responsive to gentle arousal, and more dependent on speed and intensity to reach climax. That dependence becomes a biological problem when sensitivity naturally shifts with age. Slowing down is not indulgence, it is physiological alignment. Gentle, sustained stimulation allows blood flow to improve gradually. The parasympathetic nervous system engages, breathing deepens, muscles soften. This is the biological state where the body restores rather than depletes itself. Many men tell me this feels unfamiliar at first, not because it is wrong, but because they have been rushing for so long they forgot what calm arousal feels like. Once a man understands this, he often begins noticing something else. A muscle group he has been unknowingly tensing or misusing for years, quietly weakening the very foundation that supports erections, bladder control, and sexual stability. Mistake number 4. Ignoring the pelvic floor muscles. Most men go their entire lives without being taught they even have a pelvic floor. It is not discussed, it is not visible, and until something goes wrong, it is completely ignored. Yet this small group of muscles quietly supports some of the most important functions in the male body: urination control, erection quality, ejaculation, and the structural stability of the prostate itself. By the time men reach their 60s, the condition of these muscles is biologically more important than ever. I regularly see men confused by what their bodies are doing. They notice subtle leaks when they cough or stand quickly. Erections do not feel as firm even when desire is fully present. Sensation seems delayed or inconsistent. They assume these are inevitable parts of aging. But when I ask about habits and muscle awareness, the pattern becomes clear. Many men have spent decades unknowingly tensing or straining during arousal without understanding the long-term biological consequence. During masturbation, especially when rushed, it is common for men to bear down slightly as if assisting the body toward climax. This reflex feels natural, but over time, it weakens the pelvic floor rather than engaging it correctly. Imagine relying on a muscle for decades without ever training it properly. Gradually, it loses tone. Blood flow becomes less efficient. Nerve signaling weakens. The result appears years later as reduced control and diminished confidence. What many men find surprising is how quickly awareness alone begins to create measurable change. When you learn to gently engage the pelvic floor, the same muscles you would use to stop urination midstream, You restore circulation and nerve activity to a region that has been underused and overstressed. Holding that contraction briefly and releasing it fully teaches these muscles to support arousal rather than resist it. Over time, this improves erection quality and helps restore a sense of control many men believed was gone permanently. The key is coordination, not force. Overworking these muscles can be just as counterproductive as ignoring them. Gentle engagement followed by full relaxation teaches the body to work with you rather than against you. Once a man understands how much the pelvic floor influences sensation and control, he often begins questioning another variable, how often he is masturbating, and whether that rhythm is actually supporting his prostate and energy levels or quietly pushing his biology in the wrong direction. Mistake number 5. Getting frequency completely wrong. This is one of the most common questions I receive. Usually asked quietly after the courage has been built to raise the topic at all. Am I doing this too often or not often enough anymore? What men are really asking is whether their body is still functioning normally and whether they are helping or harming themselves. The truth is, after 60, frequency matters more than most men realize. And getting it wrong in either direction can quietly affect the prostate and overall vitality. Some men masturbate frequently out of habit rather than genuine desire. It becomes automatic. They assume more must be better, that regular release must be healthy. But the body after 60 does not rebound at the same biological rate. Too much stimulation without adequate recovery can leave the prostate irritated and inflamed. Testosterone levels do not fully rebuild. Energy feels lower. Pleasure becomes flat rather than renewing. These men often feel tired afterward rather than restored, a clear signal the body is being depleted rather than supported. On the other end of the spectrum are men who go long periods without any sexual stimulation at all. Sometimes this comes from fear, sometimes from diminished desire, sometimes from the belief that abstinence protects the prostate. But complete inactivity creates its own biological problems. Circulation slows, nerve pathways receive less stimulation, tissue can lose elasticity. The pelvic region depends on healthy, consistent blood flow. Long gaps without stimulation can make arousal feel more difficult or distant when it does return. What complicates this further is that no single number applies to every man. Health, stress, medications, sleep quality, and emotional state all influence what is biologically appropriate. However, in my clinical experience, most men over 60 benefit from intentional moderation, not extremes. A rhythm that is regular enough to support circulation and prostate health, but spaced sufficiently to allow hormones and energy to rebuild. When masturbation happens with awareness at a pace that respects biological recovery, men report better erections, clearer desire, and a sense of balance rather than urgency. Pleasure feels meaningful again, not draining. The goal is not to follow an arbitrary rule. It is to listen closely to your body's response before and after. Fatigue, irritability, and loss of interest are biological signals worth heeding. Many men are surprised by how much restoring this balance improves their confidence and emotional steadiness. When frequency aligns with the body's actual needs, the constant questioning diminishes. There is trust, and that trust becomes increasingly important as you age. Mistake number 6. Applying too much pressure or force. This is the mistake I see cause the most long-term biological damage, and it almost always begins with good intentions. As men age, sensitivity naturally changes. What once felt effortless now takes longer. So many men respond instinctively, they grip harder, press more firmly, use rougher stimulation, believing they are helping their body respond. I want to be unambiguous here. This instinct is understandable, but it is biologically dangerous. The nerve endings in the penis are extremely sensitive, especially after 60. They are designed to respond to warmth, rhythm, and gentle pressure, not force. When excessive pressure is repeated over time, it creates microscopic injuries to nerve endings and surrounding tissue. These injuries do not cause sharp pain, so they go unnoticed. Instead, the damage accumulates slowly as reduced sensation, delayed arousal, or erections that feel less responsive. I have had men sit across from me and say, "It just doesn't feel the same anymore." They assume their nerves are deteriorating from age alone. They assume aging has taken something permanently. But when we look carefully at the clinical picture, the issue is often mechanical trauma, years of stimulation done in a way the tissue cannot tolerate indefinitely. Scar tissue forms. Elasticity decreases. In some cases, men develop penile curvature or discomfort that affects confidence and intimacy in ways they never expected. There is also a neurological pattern that develops alongside the physical damage. Pleasure becomes something to extract rather than experience. Men stop listening to their bodies and start overpowering them. That approach blocks the very blood flow and hormonal response needed for satisfying arousal. Instead of relaxation, the body braces. Instead of fullness, it contracts. This creates a cycle where more force produces less sensation, further accelerating the damage. What restores function is counterintuitive but powerfully supported by physiology, gentleness, slower movements, lighter pressure, giving your nervous system time to respond rather than demanding performance. Men often tell me this feels unfamiliar at first because it requires patience, but when they persist, sensation begins to return gradually and naturally. As nerve endings relearn that stimulation is safe rather than threatening, the body responds more fully. Think of how carefully you would want to be touched, with attention, softness, and respect. That same standard applies to how you treat yourself. This shift alone preserves sensation far longer than any supplement or medication ever could. Mistake number 7. Masturbating without emotional connection or intention. This is the hardest mistake to quantify because it does not show up on a lab test or a clinical exam. Yet I believe it affects more men after 60 than any of the others. Over time, masturbation can become automatic, something done out of habit, boredom, or loneliness rather than genuine desire or presence. When that happens, the body still goes through the motions, but the deeper biological systems that create restoration and emotional satisfaction remain quiet. Men describe this to me in different ways. Some say they feel surprisingly empty afterward. Others tell me they finish and immediately feel tired or disconnected, as if something was taken from them rather than returned. They don't talk about this openly because it feels confusing and deeply personal. Many assume the hollow feeling is simply another sign of aging. It is not. It is a signal that the emotional and intentional component of arousal has been removed from the equation. From a physiological standpoint, this matters significantly. When masturbation lacks presence and intention, the hormones associated with bonding, relaxation, and well-being are barely released. Oxytocin remains low. Dopamine does not restore motivation. The nervous system does not shift into a healing state. Instead of feeling grounded and calm, the body remains in a neutral or mildly stressed condition. Over time, this creates a pattern where pleasure no longer nourishes the mind or the body. What I tell my patients is this: self-pleasure does not need to be elaborate to be healthy. Even when you are alone, the body responds powerfully to attention and biological respect. When men approach the experience with awareness, slowing their breathing, noticing sensation, appreciating that their body is still capable of responding, something measurable changes. It becomes less about mechanical release and more about connection with the self. This is where many men rediscover a sense of calm and satisfaction they believed was gone. There is also something deeply important about dignity in this approach. After 60, many men struggle quietly with feeling less connected to their bodies. Bringing intention back into this moment restores a sense of ownership and self-respect. It reminds the nervous system that pleasure is not something to escape into or extract, but something that can be received fully and without shame. When masturbation includes genuine emotional presence, it works with the nervous system rather than bypassing it. Men describe sleeping better, feeling more relaxed, and carrying a quiet sense of well-being into the following day. These are not minor benefits. They affect the quality of your entire life. Mistake number 8. Treating aging as decline instead of adaptation. This may not sound like a traditional mistake, but in my experience, it may be the most damaging belief older men carry into this stage of life. Many men assume that everything related to sexuality after 60 is a slow downhill path, weaker erections, less desire, less satisfaction. So when changes appear, they stop listening to their bodies and start surrendering to assumptions. They tell themselves, this is just how it is now. And they adjust expectations downward rather than adjusting their approach with greater precision. Aging does change the body. This is biological fact. But change does not automatically mean loss. More often, it means the body is asking for different inputs, different timing, different pacing, and different care. When men treat aging as pure decline, they disconnect from curiosity. They stop experimenting thoughtfully. They stop paying attention to subtle biological feedback. Sexual activity becomes mechanical or resigned rather than adaptive and responsive. This mindset strips pleasure of its vitality at the neurological level. The nervous system responds to expectation, and when expectation is consistently low, biological response weakens accordingly. What I want men to understand is this: the body after 60 is not fragile, but it is precise. It rewards awareness. It responds to respect. Small corrections in how you touch, how you breathe, how you pace yourself generate outsized improvements. But those improvements only happen when a man believes his body is still capable of meaningful response. That belief is not wishful thinking. It is physiologically accurate. Optimism changes engagement. Engagement changes biological outcome. I have observed men in their 70s regain sensitivity, confidence, and genuine enjoyment. Not because they fought against aging, but because they cooperated with it intelligently. They stopped forcing their bodies to perform as they did at 40 and started listening carefully to what 65 or 70 was actually requiring. That shift alone reduces anxiety, which remains one of the most significant inhibitors of sexual function in older men. When you approach your body as something still learning and still adapting, everything changes. Masturbation becomes exploration rather than repetition. Sensation becomes more nuanced. Satisfaction becomes quieter but deeper and more real. This mindset also restores something many men quietly miss: self-respect. Respect for the body they inhabit now, not the body they once had. That respect translates into better care, better boundaries, and measurably better outcomes across both sexual and emotional health. Final message: if you take one thing away from this conversation, let it be this: you are not broken, and your body is not failing you. What it has been doing quietly and patiently is asking for a different kind of attention than it needed when you were younger. Aging does not erase vitality. It changes the biological rules by which vitality is maintained. And once you understand those rules, everything feels far less frightening and far more manageable. For many men over 60, the greatest damage does not come from a medical condition. It comes from repetition without awareness, from doing what once worked without recognizing that the body has evolved. These mistakes are not signs of weakness or poor judgment. They are the result of silence, insufficient education, and the understandable assumption that no visible symptoms meant no problem. Now you know better. And knowledge, applied consistently and with patience, is one of the most powerful tools in medicine. Your sexual health is not separate from your overall well-being. It affects your confidence, your mood, your sleep, and the way you move through the world. When masturbation is done with care, intention, and biological respect for how your body functions today, it can actively support circulation, calm the nervous system, and reinforce a sense of dignity that many men fear they have lost with age. That dignity matters deeply. It shapes how you see yourself. There is no need for shame here. None of these topics make you less of a man. Choosing to learn and adapt at this stage of life is a quiet but genuine form of strength. It demonstrates self-respect and responsibility, and it shows that you remain fully invested in your quality of life, not just its length. Change does not need to be dramatic to be effective. Small adjustments, practiced consistently, create biological momentum. Gentler touch, better positioning, slower pacing, awareness of your muscles, respect for recovery time, emotional presence, and a more accurate mindset about what aging actually is. Each of these sends a clear signal to your nervous system that it is safe, supported, and valued. That signal alone improves function more than most men expect. If you have noticed changes, less sensitivity, weaker erections, reduced satisfaction, do not assume the chapter is closing. In many cases, your body has simply been asking for a language you have not yet learned to speak. Learn it now. Give yourself patience. Improvement after 60 is often quieter, but it is real and it is achievable. The men who do best as they age are not those who try to hold on to the past. They are the ones who stay curious, attentive, and genuinely kind to their bodies in the present. Your body is still communicating with you. When you listen carefully, it responds. If this message resonated with you, carry it forward, apply it calmly, observe honestly, and allow yourself to be encouraged by small signs of progress. They accumulate. Your later years are not about decline. They are about biological refinement. And the choices you make now will shape how strong, confident, and connected you feel moving forward. As we bring this conversation to a close, I want to leave you with the most important lesson for men in their later years. Aging does not mean you stop caring for your body. It means you care for it more wisely and with greater precision. The habits that once felt harmless can have very different biological effects after 60, not because you are weaker, but because your body now responds to intentional care rather than automatic force. Awareness, patience, and respect are no longer optional. They are essential tools. For older men, the real danger is not sexuality itself. It is silence and unexamined routine, doing things automatically without listening to the biological feedback your body is constantly offering. When you pay attention, adjust your approach, and treat your body as something still capable of learning and responding, you protect not only your sexual health, but your confidence and emotional balance as well. The lesson is simple but powerful. Slow down. Be intentional. Stop judging yourself harshly for natural biological changes. Pleasure, connection, and vitality do not disappear with age. They evolve. When you work with your body rather than against it, you give yourself the best possible chance to remain strong, present, and genuinely fulfilled in this stage of life. If this message helped you understand your body better, I encourage you to support this channel. Take a moment to like this video so it can reach other men who need this guidance but do not know where to look. Share it with a friend, a brother, or anyone you care about who is navigating these changes quietly. Leave a comment below and let me know which insight stood out to you most. Your experience may help another man feel less alone. And if you believe in education that protects dignity and health for older men, consider supporting this work so we can continue creating clear, respectful, and scientifically grounded content for men at every stage of life. Thank you for being here and for taking your health seriously.